1 in 3,500. This is a prevalence rate of a disease called Duchenne muscular dystrophy, or DMD, as 1 in every 3,500 boys born across the world are estimated to have DMD. In the United States, about 250,000 individuals are estimated to be diagnosed with this disease. Now, imagine that you have a friend with DMD. Today, I'll be exploring 3 different surgical procedures using simulation so that you can learn about some of the procedures that your friend might choose to have during his lifetime. And before we dive into the surgical procedures, let's learn about DMD. Duchenne muscular dystrophy is a disease that predominantly affects males. From the medical and scientific perspectives, the disease is caused by a mutation in the dystrophin gene located on the X chromosome, and this mutation leads to minimal to no dystrophin proteins being present in one's muscle cells. Without dystrophin or the dystrophin glycoprotein complex, the muscle cells become more prone to contraction-induced injuries. Aside from muscle degeneration, other phenotypes include cardiomyopathy, respiratory failure, and scoliosis. Now, let's talk about our first procedure. Imagine your friend having really bad back pain from his scoliosis. Spinal fusion is a procedure that he may choose to have. Here is a simulation of what the spinal fusion procedure may look like. This is a procedure where the spine is straightened and the vertebrae are fused into one. Although the cause of scoliosis in individuals with DMD is not known, it is a progressive condition and no preventative medication are available. Studies have observed a prolonged ambulation period, increased muscle strength, increased quality of life, and improved cardiac functions for individuals who have both DMD and scoliosis that have received this procedure. Another condition that your friend might be experiencing is joint pain. A tendon release surgery is a procedure that can alleviate this pain. Before getting into the specifics about the procedure, let's watch a simulation that I made that shows how the muscle might look like in individuals with DMD. Imagine that this is a cell from someone that doesn't have DMD. The muscle can contract and there is some tension at its resting position. For individuals with DMD, their muscles become weak and short, so this is what they'll look like, or even in extreme cases, it might be shorter. As a result, the resulting position is shorter and it results in pain. Again, as muscles become weak and atrophy, muscles become shorter and thus cannot maintain the tension at its resting position. This procedure releases the muscle from joints and thus alleviates pain. Some of the benefits associated with this procedure are that it reduces pain and makes walking easier for ambulant individuals. However, it is also important to note that this procedure is available for individuals who are not ambulant, as they may also be experiencing pain from muscle shortening. As with any procedures, this procedure also comes with its cons. One of the cons is that individuals have to wear a cast for 3 weeks after the operation. Lastly, we'll talk about tracheostomy. As the disease progresses, respiratory functions worsen, and the later stages of the disease require ventilation. Tracheostomy is a procedure in which an incision is made so that air can enter the trachea from the tracheostomy tubes, as shown in this simulation. Ventilators can also be connected to the tube, and a study has shown that events of nocturnal hypoxia were reduced for individuals with DMD after the tracheostomy procedure. This ensures that oxygen is delivered to lungs during day and night. One of the downsides is that it impairs swallowing, and this may require individuals to get another procedure called gastrostomy tube insertion so that they're able to get nutrients even when they're not able to eat from their mouth. Here are some other procedures that are available. Individuals may decide to have pacemakers if they have arrhythmias, and again, G-tube insertions if they have trouble eating orally. I hope I was able to tell you a story of how the lack of a cure requires individuals with DMD to constantly explore through different procedures and weigh their pros and cons. With the hope that a cure for DMD is around the corner, I would like to end my presentation, and I hope I was able to share something that you didn't know. Thank you so much.